Uh,
Bye-bye. Hello, this is Dr. X, doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Tom Cruise and I am 60 years.
How may I address you?
Doctor, please call me Tom.
Okay, Mr. Tom. Today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
During our discussion, I might take down some notes, which will be strictly confidential. Is it okay with you?
No problem.
Okay. So, Mr. Tom, can you please tell me in your own words what have brought you here today?
Doctor, actually, this is not a new problem. For the last 3 months, I am suffering from this. I am suffering from recurrent vomiting for the last 3 months. And sometimes after vomiting, I vomit so much, a large amount that I feel some dehydrated, something lethargic. This happened to me about 3 to 4 times over the last 3 months. And this time also I had this type of vomiting, but this time I also feel that I am very much lethargic, very much dehydrated, and I cannot manage myself. I even cannot take a proper amount of drinking food. I cannot take a. This has become somewhat miserable for me. So I visited my GP this time, and he thought that I need better evaluation. So he sent me here, and also he ran some blood test, but said that there are some abnormal low level with some salt in my blood.
Okay. We will try our level best to find out the cause of your symptoms. You told that your vomiting first started 3 months back. Well, has the vomiting pattern changed, like the volume of vomiting or the content, or has it been the same for the last 3 months?
I think I am as day progress, I am passing more amount of vomitus.
Okay. Can you tell me about the content of vomitus? What does it
Doctor,
contain? Any food
sometimes
material or something
the
like that?
vomitus, yes, doctor, vomit. I usually vomit after taking food after about sometimes 15 to 30 minutes after taking the food, and
Okay.
the sometimes it contain the food, all the food, and sometimes it also contain the food that I have taken the previous day. Sometimes
Okay. And
there are some foul smelling.
some foul smelling. Okay. And do you think that anything makes it worse, your symptoms?
Taking food makes my symptom worse.
Okay. And anything makes it better?
I feel discomfort, and after vomiting, I feel somewhat better, but at the same time, I also feel lethargic.
You feel lethargy. Okay. Well, can you say that have you ever feel nauseated during this vomiting?
Sometimes, but not so much. Just
Okay.
before
And
vomiting.
okay, you told that the vomitus is larger in amount now, but has the frequency increased? Like how many times do you vomit in a day or in a week nowadays?
Not every day, doctor. Sometimes
Okay.
about once in 15 days, like that.
Okay. Okay, and has it increased in your frequency like 3 months back? Has it increased or remained the same?
Yes, doctor. For last months, I have vomited about 3 times.
Okay, okay, and 3 months back, how many times had to vomit for 1 month?
About a single episode in a month.
Okay, and have you ever noticed any blood in your vomitus?
No,
Okay, do you ever feel nauseated?
just before vomiting.
Yes, you're vomiting. Okay, and have you lost any weight? Have you noticed?
Yes, doctor. As I told you that taking food makes my symptom worse, so I usually try to avoid food. And also I have a problem with food fasting for last 1 year, so I cannot take as much food as I need. for this I am losing weight, and I think for last 3 to 4 months I have lost about 6 kg.
Okay, I can get it. Well, you think that you have some problem with your food taking. Well, can you please tell me that do you have any difficulty while taking food?
Yes, doctor.
Okay, when did it started?
About 1 year ago.
Okay, and how did it started? Did it come along suddenly or gradually?
Gradually, not suddenly.
Okay, can you please tell what type of food causes it more, this ticking or this problem in swallowing?
What
So
type of
solid or
food?
liquid?
Initially, it was with solid food. I needed to take some water to pass it down, but
Okay,
now I feel all the same with each type of food.
same type. Okay, and well, is it present all the time? Do you think this problem, this food swallowing problem,
Uh,
or does it come?
I was given omeprazole capsule after doing a painful uh, camera test of my food pipe,
Okay,
and I felt somewhat better with that. But for last 3 months, I am facing the
okay,
problem much more than ever.
much more than over. Okay, okay, and do you think that anything makes you feel better about this food swallowing problem?
No,
Anything makes it worse?
no,
Okay. And well, can you please tell me that do you have any tummy pain?
no.
Okay. Any how about your bowel movements?
Sometimes I feel that I am constipated. Sometimes I pass 2 or 3 times a week.
Okay. Do you feel any pain while doing your bowel movement?
No,
Okay.
just,
Any blood any times you have noticed?
no, just a little amount, and it is hardest to.
It's hard still. Okay. No blood any time. Okay. And no pain. Okay. And well, can you please tell me that do you have ever regurgitated any food?
Yes,
How many times, or when did it occur?
uh, this is for last 3 to 4 months, and regurgitation is a quite a common case for me. About once every day or every 2 days, but amount is less. And when I
Amount is
do
less.
it,
Have you ever?
amount is
Okay,
heavy.
okay. Have you ever regurgitated any food from your nose?
No,
Okay. And do you have any cough?
no.
Okay. And you told us sometimes you have regurgitated food. Do you feel any sour taste in your mouth at that time?
Sometimes, not always.
Okay. And well, have you ever felt that there is any yellowish discoloration of your body?
No,
Okay. And okay. And may I ask you some other questions? Do you have any headache?
no,
Okay. Any changes in your vision or problem in vision?
no,
Any soreness in your mouth?
no,
Any skin rashes?
no,
Any joint pain?
no,
Any weakness or abnormal sensation in any part of your body?
no,
Okay. Okay. And any specific weakness in any part of your body?
no.
Okay. Any chest pain?
Some discomfort in my chest, no pain.
Okay. And can you please describe it?
Discomfort mostly when I lie down at night. I feel somewhat
Okay.
tightness in my chest, center
Okay.
part.
Does it go anywhere else, or does it just stay in the chest?
No, it doesn't go.
Okay. And for how long does it stay, this pain or discomfort?
After I take a sleep, I usually feel no problem.
Okay. Okay. And okay. And well, do you have any racing and pacing of your heart?
No,
Any shortness of breath?
no,
Okay. And do you have any noisy chest?
No,
Did you ever cough up any blood?
no, never.
Okay. And did you ever had any trauma in your head?
No,
Okay. And any whatever your water was, is it all right?
all right.
Okay. And okay. And any weather preferences do you have?
No, no,
Okay. And no weather preferences. And any lumps and bumps anywhere in your body?
no,
Okay. And okay. And any waist temperature?
no.
Okay. May I ask you some questions now? Well, do you have any long term illness? No. Do you know of any like diabetes, hypertension, or anything like that?
No, doctor, I was quite a fit man before this symptom.
Okay. And I get it. And do you take any medication other than your tablet for difficulty swallowing?
No,
Any over the counter medication?
no,
Any herbal medication?
no,
I'm sorry to ask, do you take any recreational medication?
no, never.
Okay. Any allergy to any medication?
No,
Okay. Any blood transfusion history?
no.
Okay. And do you have any family member with any low known chronic disease or any cancer?
My father had some heart issue. He had heart attack when he was 60.
Okay. Get it. Okay. And may I ask you some other questions, some personal questions? Do you smoke?
No,
Do you eat? You take betel nuts?
no.
Okay. Do you drink alcohol?
27. Yes, doctor.
Do you drink? How many pints?
That is about 4 or 5 units per day for last 30 years.
Okay. Any binge drinking?
No, usually never.
Okay. Okay, okay. And actually, alcohol is a very dangerous thing, alcohol consumption, and it can also it can also add to your symptoms. So I think it's a high time stop stop taking alcohol. And if you want, I can we can refer you to the clinic. Okay.
Oh,
And okay. And may I know that did you have any travel history recently to any
no,
other country?
no.
Okay. May I know that whom do you live with?
I'm living alone.
Alone. Okay. It's a very personal question, but may I know that do you have any casual relationships?
No, doctor.
Okay, I'm very sorry to ask, but I had to ask it. Okay. And may I know that what do you do for your living?
I work as a mechanic, but I am doing nothing now.
Okay. Well, do you think that you need any support socially or economically?
That will be very helpful.
Okay. And what about your mood? May I know about it?
I am more or less same.
Okay. Okay. And may I know what your concern is?
Why I am having this, doctor? I was said that I have problem with my food pipe a year ago. And
Yeah. Yeah.
after taking the treatment, I am having this problem. And that time, the test was very painful for me. But now I am also
Yeah.
suffering this. Why?
Yeah. Yeah. I get it. Well, at the time we have to at this time
I'm
we have
up.
to first examine you properly, and then we can examine you properly, and then we can to give you full explanation. But as long as we have taken history, it might be possible that uh, well, as long as we have taken history, there can be some possibilities there. And I'm sorry to say that one possibility is that you might have a bad nasty growth in your food pipe, uh, but we cannot be sure at this moment. We first have to run some tests, and we also will have to involve the doctor, bowel doctor, to uh, see that whether you need any special camera test again to look at your food pipe. Okay. And after all these things, we can get to you with a better and full explanation. Are you getting me?
Well, doctor,
Any more concerns?
I am really worried that doctor, I cannot go for the test again because that was very discomfortable and that was very painful for me. Do you have any alternative?
Yeah, we will. I will, of course, convey your concern to the consultant, and he will look more into the matter that whether anything can be done or what will be the best test for you. Will it be all right?
Okay, doctor. Do I need admission?
Anyone? Well, at this moment, we will first carry out the full examination, and then uh, carry out the full examination. And since you have some symptoms like loss of weight and also some vomiting again and again, you might be expected to remain under observation since we complete the investigations. Okay.
Okay, doctor. Thank you.
Any more concern?
No, you have explained everything well. So, what do you think that is happening to this patient?
Well, mm, since his recurrent vomiting, and also he had some issues with dysphagia, I think, which is more both with solid and liquid, and I think that this might be caused by some mechanical issues in the food pipe, or I think in the esophagus, and I think it can be gastric outlet obstruction also, but and the cause might be, considering his age, it might be caused by cancer of esophagus, and also it can be caused by stricture esophagus. And since he told about some pain while doing the camera test, I think the endoscopy, we might think of some infective causes as well, although there was no risk factor I could elicit around about it. So these things, I think, could have been more prominent, I think.
Can echinacea cardia be a cause?
Yes, achalasia can be a cause. Achalasia can be a cause.
How will you investigate?
Yeah. Well, I think I will investigate first by doing some blood tests and some routine blood tests like CBC, ESR, CRP. Then I will go for barium swallow test, and also I will go for esophageal manometry and esophageal pH studies. And since he complains about some pain, I will actually first involve the consultant, the gastro consultant, to about whether to run endoscopy test or what to do about it. Okay, I think these are the main tests, and also I will run and chest X-ray behavior.
What do you expect on cystic X-ray if it is a case of echinacea cardia?
Well, in the chest X-ray, I think I will find some dilatation. Okay, in the proximal part of esophagus, and uh, and that will be behind the shadow of the heart.
Okay.
And in case of barium swallow, I will get proximal dilatation with smooth tapering in the lower end.
Can you differentiate on barium swallow, or can you assume that how will you get the picture of carcinoma esophagus and echinacea cardia?
Yeah. In achalasia, actually, the proximal dilatation is also very smooth. There is usually no irregular margins in that. There will be smooth proximal dilatation, and in the distal end, this is smooth tapering. But in case of CA esophagus, usually there can be some irregular margins, and also there can be some problem, uh, some feeling defects. We can feel some irregular feeling defects. And another thing is that in case of achalasia, usually the dye doesn't go into the proximal part of stomach, the fundus. Okay, but in case of CO2 achalasia, like C esophagus or other things, this dye can pass through, and we can see some dye in the fundus also. I think these are the main important differential points.
Okay, thank you.
Okay.
How will you manage him?
Actually, at first, if it's considered a case of achalasia, then there can be some treatments, some medical treatments, and also some surgical treatments as well. And however, we can do some balloon dilatation, pneumatic balloon dilatation, and also in case of surgery, we can think about Heller's cardiomyotomy, Heller's myotomy, I think. And for drug choice, I think we can think about calcium channel blockers or nitrates.
Botulinum injection.
I told botulinum injection, pneumatic dilatation, botulinum injection.
Okay, that is fine. Okay, thank you.
Okay, thank you.
Okay, your presentation, your approach, your history taking was all systematic, and I cannot bring anything in attention that you have missed. Everything was taken in systematic way.
Okay.
So you have done everything well.
But I think I missed the case.
No, this is not a case of with exact diagnosis, but there are few possibilities, and the
Yeah.
most likely case is cardia, but it can
Well,
also
may I know
at,
why achalasia?
at his age. Okay, actually, he has discomfort at night and recurrent regurgitation of food that is most likely dilated esophagus, not just a cancer.
Sorry, sorry. Can you please repeat again once more? Just don't get it.
Okay, for the gentleman, as he has history of retrosternal discomfort and regurgitation of food, recurrent regurgitation of food.
Mm-hmm. Mm-hmm. This goes more in favor of achalasia.
Achalasia, because and also with carcinoma they develop within a short time, and also that
Mm.
usually don't allow so much time to dilate esophagus. Okay, but it is a case where the exact diagnosis isn't
Okay, okay.
revealed until the test is done.
Yeah, 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 yeah.
So yeah, guys, everything was fine.
Okay, okay. So I think the recording can be stopped now.